recording. All right. We have people coming in. All right. Welcome. Hello, everybody. This is our Tea Talk special edition, Adenomyosis Awareness Month. Very briefly, please hold your questions to the end if you can, and just send me a message directly if you can. So let's go ahead and get started. Welcome to our Tea Talk. The Endometriosis Foundation of Houston is a 501c3 charitable organization. It's created with the purpose of increasing disease recognition, offering vital support services to individuals battling endometriosis in the Bayou City, and helping connect patients, communities, stakeholders, and healthcare clinicians to promote advocacy programs nationwide. We collaborate with local experts and national organizations to promote reliable, accurate endometriosis information. Our support group has helped hundreds of people find proper care in Houston. Tea Talk is our monthly speaker series where we recruit advocates and medical providers and clinicians to educate and support patients on their journey to a healthier, more functional life with endometriosis and related diseases. So grab your cup of tea and let's get started. I am so excited to have Caitlin McDonough from the Adeno Project join us today. She's a clinical social worker and public health advocate from Massachusetts. She is passionate about health education and increasing access to care. She has been living with pelvic pain due to endometriosis, adenomyosis, interstitial cystitis since she was a teenager. After many difficult experiences navigating her own care and feeling isolated, she turned to the internet for more information and support. She founded the Adeno Project in 2020 to challenge the stigma surrounding pelvic pain that contributes to misdiagnosis, misinformation, and suffering. Caitlin wanted to create a safe space for others, knowing how difficult it was to navigate this diagnosis with limited information. And the Adeno Project is focused on awareness, dispelling myths, providing education, and advocating for better care. Welcome, Caitlin. Thank you so much for joining us.
Thank you. Happy to be here today. Just let me know if my internet is wonky at any point because it's like off and on for whatever reason. Of course, when I'm doing something like this, never another time.
Of course.
The worst time. But today I wanted to talk about some of the myths surrounding adenomyosis because, like as we mentioned, there's so much misinformation and also lack of information, and then those two things combined just contribute to a lot of myths that circulate within the medical field and everywhere else. But just a disclaimer, I'm not a healthcare professional or can't provide medical advice. So this is all information that I've found and put together from doing research about the disease to help myself and then to help other people as well. And so later on, like in the next few months as well, I just want to share, I will be posting more about like breaking down other research, like the more recent research from 2021, because there's some different things that are coming out, but all of these myths that I'm going to talk about today are from like 2019 and 2020 research that was put out about adenomyosis. So I have some different myths here to talk about. So I'll start with the first one, which will also kind of explain what the difference is between adenomyosis and endometriosis. So the first myth is that adenomyosis is the same condition as endometriosis. And this is something that circulates a lot within like the doctor's office, and then it just becomes more widely spread. But they are two separate conditions. It was believed for some time that they were like a subset of one another, or I know it's even circulated that they're sisters, but it may be more like they're cousins. It's not really totally understood what the relationship is between the two of them. But adenomyosis is a condition confined to the uterus. So it's when the endometrium, or the inner lining of the uterus, invades the myometrium, or the muscular wall of the uterus. And that can be through diffuse adenomyosis, which is widespread kind of lesions. that are not always visible. They can be really small. And then also through adenomyomas, which are more like kind of similar, can look similar to fibroids, larger lesions that can possibly be removed. And then endometriosis is a condition where it's tissue similar to the lining of the uterus or the endometrium, and there's no cure for endometriosis. But with adenomyosis, there is a cure, which is a hysterectomy, although it's not a great option and definitely need more treatment options available for that reason as well. And then, so the second myth is also was very common within, I think, most of the research I've done looking at like larger health institutions, what kind of information they put out about adenomyosis on their patient pages, is that adenomyosis only impacts those who are older. So like ages 45 plus, usually like 50s, 60s is what they're talking about. And people who are assigned female at birth, who have already gone through childbearing, so they've already had pregnancies. It was believed that those were the only people that adenomyosis really impacted, and that for younger folks, adenomyosis wouldn't be a concern that anyone would have to worry about or look into, but that is constantly kind of coming up again in research and being debunked. Unfortunately, a lot of the research that's put out is really small sample sizes, so there isn't like a clear-cut long-term study investigating it. It's usually confined to like a certain doctor or country, so it's really hard to kind of, it's really hard to kind of see how that impacts everyone and like compare it to the larger population. But a lot of it is showing that it is a condition that's diagnosed younger and younger, and it's not rare for younger people to be diagnosed. Like I myself first started having symptoms when I was around 21, I believe, when I was still on hormone therapy, and then was officially diagnosed, or I guess not officially, since I'll talk about that in a second, how official diagnosis is through a hysterectomy, but I was diagnosed when it was seen on my MRI when I was 24. And that's more common, I think, like the people that I talk to through the Adeno Project, a large amount are pretty young, like teens to like 30s, I would say is like the most common age group. And then the third myth is that adenomyosis can't cause symptoms outside of your period, that if you're having pain, fatigue, like pain in your pelvis, pain in your back, bowel movement issues, bladder issues, leg pain, those symptoms, if it's not during your period, it's not from adenomyosis. And that is another huge myth. Adenomyosis can cause symptoms throughout the month. It's not just confined to the uterus. And in some of the research, they have found that some patients can have relief like during their actual period. So they might have the worst of their symptoms leading up to their period. And then the period is kind of like a release from that if they're not on hormone treatment, especially. And then the fourth myth is that it can't be adenomyosis if there's a trial of hormone therapy and that does not improve the symptoms. And that is kind of similar to the period myth. So it's not proven to be true. Hormone therapy is one of the treatment options and one of probably the most common ones that are used for adenomyosis and related conditions. But even if hormone therapy isn't successful, that doesn't mean it's not adenomyosis. Or even on the other hand, if it is successful, that also, doesn't mean that either. So there's no clear cut, like if this treatment doesn't work, it's not adenomyosis, which is a large myth, I think, with all kind of, like, with endometriosis, I know that's one of the myths too, like if you don't respond to hormone therapy, it can't be that. So there's just a lot of these myths impact all of these pelvic pain conditions, and they're kind of just like recycled in a sense from one to the other, and then are unfortunately circulated as truths. And then the fifth myth is that clear imaging or examination means you can't have adenomyosis, which is not true. Adenomyosis is a really tricky disease, especially if it's diffuse adenomyosis, so the widespread, because the lesions can be very small, and being that they're in the muscular wall, that's not, our technology, even in 2022, just can't always catch that. And then like the various stages of when that might be forming for someone, which is another piece of the puzzle that we don't understand, because age doesn't seem to correlate with the type of adenomyosis or severity. And then the symptoms don't correlate with severity either. So it's just like there's so much unknown, and that is like the trend with these myths that contribute to it, but it hides deep. So it's not always clear, like during surgery or physical exam, someone, their uterus may look and seem great, but that's not the truth for what's really going on. And so it's really important to consider the symptoms as part of it, and then also ruling out other pelvic pain issues that may be contributing, because the symptoms do overlap with so many other conditions, and trying to kind of pinpoint what might be going on. So symptoms are the biggest indicator of adenomyosis. And kind of with that as well, even if someone has a hysterectomy for adenomyosis, it may not always show on pathology for the same reason as imaging that it may not show, because it can be hiding deep in the uterus. And we really just need more research for that, because a lot of the research is done on older individuals who may have more severe and advanced adenomyosis. So it may be more apparent on their pathology versus someone who's younger, whose uterus, they might not be dissecting every single piece of it, and therefore it can be easily missed because it can hide pretty easily. And then the sixth myth is that adenomyosis is a rare condition. I think this is believed to be true because it's not talked about. So people think if it's not talked about, then it must be rare. And then unfortunately, because it's not talked about and it's kind of ignored and hidden, then it's not receiving a lot of research funding. And then that means it's not receiving a lot of attention. The treatments are kind of stuck. They've been stuck for a while, although I'll talk in a minute about some other treatments, but there just isn't enough out there. So then it's believed that it's rare, but it's a very common condition from what I can find from both like talking to people and then also working through research. So research from 2019 estimated that adenomyosis affects around 20 to 35% of assigned female at birth individuals. But other research has estimated it from anywhere a range of 5 to 70%. So it's really not known. The estimates are kind of all over the place. More reason why we need up-to-date research and a long-term study to try to investigate that. But a lot of the issue is that it's either misdiagnosed or being completely ignored until people are older, and then maybe they're having a hysterectomy at that point in time. So we just need some more research for larger population studies so we can kind of figure that out. And then in turn, that would also help with figuring out some treatment and better diagnostic criteria as well. The seventh myth is that adenomyosis can only cause severe symptoms, which is also not true. Some people, similarly to endometriosis, it may be silent and they may be asymptomatic. So it might be found later in life, maybe if they're having a hysterectomy for fibroids or something else that's a little bit more clear, or if they're having surgery for endometriosis, or if they're investigating fertility struggles. So for some people, it can cause very severe symptoms and impact their functioning, but some people may be asymptomatic. So there is a range there as well. Again, not totally understood. Or they may think as well that their symptoms were normal. So then that also adds in some complication to that as well. So they may not go to the doctor to investigate those symptoms, thinking it's just kind of a normal period. The eighth myth is that it's just a bad period, which is not true. As I mentioned, symptoms can occur throughout the month, not just around your period. And the level of symptoms, any severe pain is not normal. So it shouldn't be just assumed to be a bad period and something that someone has to live with. These symptoms can be really devastating and we need more support for that, but it's not just kind of a normal occurrence. And then I just wanted to talk about some of the issues. So like with treatments, which impacts all of these myths, because we just don't have much available and there's no clear-cut diagnostic approach, which is one of the complaints and concerns from like the more recent research, is that across all of these different countries and doctors, there's just no clear-cut answer for how do we diagnose this, which contributes, I think, to a lot of the like misdiagnosis and issues, and maybe means why some doctors don't even want to approach this or get involved because it's just so complicated. So one of the hopes for the most recent research was that we would obtain some clear-cut diagnostic criteria, and then that in turn would help increase research and then increase treatments. As right now, the only treatment is, or the only curative treatment is a hysterectomy, and it's believed that is right now the gold standard treatment would be a hysterectomy with biopsy of the uterus. But as I mentioned earlier, that even could, not everyone who has a hysterectomy with a biopsy, their biopsy might not show adenomyosis, but that doesn't mean they don't have adenomyosis, because it can be very easily missed. So I've spoken to some doctors about that, and really the most important piece of that is that they're thinking about how the patient's doing after the hysterectomy, and knowing that the uterus can be pretty angry and the source of pain, even if pathology is not showing that. And that doesn't always mean they don't have adenomyosis, or maybe some other condition that we just don't know about right now. So the treatment options are very limited. So hormones are the main treatment option, and then pain and symptom management. There are some surgical procedures, but those are very limited depending on where you live. You may or may not have access to providers who perform those because they're very specialized. Like the presacral neurectomy is when they're cutting the nerves to the uterus in hopes to minimize some of that midline pain and pain that goes down the legs. But that's done by providers, who are very specialized in that. It's not just something that any surgeon can do. And then some other surgical procedures are like uterine artery embolization. That's a little bit more of a rare procedure done. I think for my research, it's becoming more common, but still very specialized procedure. And then if there's focal adenomyosis, so the large kind of area of growth, they may be able to cut that out to remove that lesion. There are complications with that procedure and with the other surgical procedures as well. And it's just really important that if you are considering those kind of procedures, making sure and seeing how many your doctor is performing a year and what their outcomes are, because they do have some risks associated with that. And they're just not readily available everywhere, unfortunately. So that's kind of one of the biggest struggles with this disease, is the lack of treatment options and limited availability and accessibility for those. So I think one of the best things for adenomyosis would be to kind of have a subspecialty for adenomyosis. And I know some endometriosis doctors who perform excision kind of do that on their own, but if we could also have maybe some branch out for that, that are performing surgical procedures and then also focusing on pain and symptom management, I think that would be the best outcome. Because understandably, gynecologists who are delivering babies and focused on the OB side of things can't really develop their skills for adenomyosis, because it's such a specialized condition working with the uterus and the muscular layers of the uterus. And then one other thing I wanted to point out, kind of related to the myths, is that patients can have adenomyosis, endometriosis, and fibroids. So some patients have all three. Some have, a variety of those three, or may just have one. So I think that's one of the myths as well, is that you can't have fibroids and adenomyosis. And one of the tricky things with imaging is that it may look like fibroids, but it could be adenomyosis. So just more reason why we need improved technology for these imaging. And I know that some people have shared with me that their doctors are now performing high frequency ultrasound. And the doctor is the one performing that, trying to get a better look at the uterus, which is really great. And hopefully something that will be more accessible everywhere. And I think that's everything.
Thank you. That was really, there's a lot of very good information. I think, listening to you, we were kind of all also reflecting how even the definition of adenomyosis has changed, even very recently, within the past couple of years or so.
Yeah.
Well, yeah, and obviously, just like endometriosis, there's obviously a lack of research. Research will hopefully help with answering some of these questions, but are there any research going on right now? Who should we keep an eye on who's doing the research? Who's funding these research? Who are some of these institutions that we should maybe follow or learn from, if you
Yeah,
know
that's a
any?
great question. I'm not sure at the moment who is like there. I need to do that's part of one of the things I'm looking to kind of research myself more and see because like the NIH, unfortunately, from what I could see recently, and I always check it like periodically to see, but they aren't doing anything. I'm
Mm.
wondering with the like increased funding for endometriosis research, if maybe some of that might reach adeno or not. I guess possibly because there is a little bit of an overlap. But that is a great question. I need to look more into that and see. I think like in the US, I feel like I'm not sure. It's usually like other countries from what I can see that are doing more research. In the US, most of the research studies I've looked at, even like within the last few years, like from 2019 on, they're really small sample sizes. But I think that's part of the like frustration for those researchers too, is maybe they can't find funding and they're like trying to do all these smaller studies in hopes to expand that. That is a great question.
Um, I know a lot of the symptoms overlapped between, endometriosis and adenomyosis. I have both as well. Can you expand on maybe what are some of the common symptoms of adenomyosis, especially for people who may have, gotten excision surgery and they're like, oh, you don't have endometriosis. So, but they still have some of these other symptoms. Can you please expand on those symptoms maybe?
Yeah, so I would say the most common symptoms are definitely like that midline low pelvic pain that people often report will go down their legs and also into their back, which makes sense, kind of where adeno can be deep in the muscular wall. That might be irritating the back as well. So, like low back pain is very common, bloating, it might feel like a pressure in your pelvis, kind of like a bowling ball sensation, really swollen. A lot of people report fatigue, migraines, GI symptoms like issue with bowel movements, bladder, pain with sex, pain with exercise. Um, Not being, I think one of the biggest symptoms, I know like I've posted about it and others have too, is like not being able to wear tight clothing or pants because it really irritates your pelvis and kind of increases that swelling and inflammation. Um, and then like bleeding, some people definitely have reported like having heavy clots as well. Um, yeah, I would say pain is like the probably biggest symptom people report. And just overall like feeling very fatigued and dizzy, like symptoms they may have more symptoms if like they're having more bleeding because of blood loss as well.
Um, since one of our focuses with the Endometriosis Foundation of Houston is pelvic floor physical therapy. How does that play a role in alleviating some pain for anyone with adenomyosis?
Yeah, I think it can definitely, like I know for myself, it helped a little bit. Um, so I think it's always worth trying to see if it might help, especially for someone who maybe like or isn't yet diagnosed or having trouble getting that diagnosis, not sure kind of what's the cause for their pain. Sorry, my dogs might be they're making a lot of noise. Um, or just kind of seeing what might help them. Like, I don't think it hurts, especially knowing like adenomyosis really flares up and causes a lot of inflammation in the pelvis. So it doesn't hurt to do something to try to relax those muscles that understandably are becoming really irritated throughout the month because of the flare of symptoms. So I think it can be helpful. And like for some people, it may flare up symptoms depending on where they are, in the month and within their own flares. But that's something to talk about with the physical therapist and see what options are available and what you're comfortable with. But I think it's always beneficial. Even for myself, like when I've been in the deepest flare with adeno, it still was helpful to try and learn strategies that can be helpful, even if I couldn't tolerate PT like during that day.
Yes, a lot. And you have to find those physical therapists who know about adenomyosis, or at least familiar with adenomyosis and endometriosis and
Yeah.
familiar, and similar diseases. We have a question. Do we know anything about why people develop adeno?
Sorry, what was that?
Do we know anything about why people develop adenomyosis?
Yeah, that's a great question. Unfortunately, we don't. Even so, like this past week, I've been working through some research articles I hadn't read yet, and like seeing about when adenomyosis was first noted, like many years ago. And there's so many like different theories, but there isn't one really that seems to have stuck. I think that's part of the mystery of this disease. They just don't really know. So I haven't really come across a specific theory that like multiple researchers seem to believe, or have like strong evidence behind.
Um, have you seen anything about how diet plays a role with adenomyosis as well in managing, or yeah, in managing the pain
Yeah,
or the
I would
symptoms?
say, yeah, it's hard. I think it's hard with diet. Like it can go either direction, but I've spoken to people who personally have tried, like low inflammatory diet, or maybe have tried like low FODMAP or something and may have found it helpful for their symptoms. And then there are people who haven't. I think, yeah, with diet, there's such a variety of mixed reviews on, but like I think it's always worth trying and seeing, especially knowing like with adenomyosis, there's so many comorbidities and issues. Like I myself was recently diagnosed with SIBO years after my hysterectomy, and that definitely flared up my whole body and GI system. So like low FODMAP has been helpful for me at times, and anti-inflammatory diet. Some people are dairy free and find that helpful, or gluten free, but it's so mixed. But I think it can be helpful. And I know on like Instagram, there are a lot of accounts that are focused on that, and nutritionists that could be helpful for that as well.
I know you touched on, what are your treatment options, um, lack of research. Um, for those who are kind of new to this, or still dealing with it, what can we do to advocate for ourselves?
Yeah, that's a great question. I would say first, like I've found it helpful to keep a journal of my symptoms, dates, and like if you're having a period, kind of tracking that as well, and tracking ovulation, and then having that available when you go to doctor offices or consult with different providers. But really, that can be helpful for yourself as well to see if there's any kind of trend in your symptoms. But my biggest advice would be to really just like trust yourself, and when something's not right for you, kind of know what your normal is and what's not normal. And if a doctor isn't listening to you, always getting another opinion, whether that's like second or third opinion, whatever you can do with that. I know it can be tough depending on your insurance company. If you're able to get a third opinion, you're usually able to get a second one, but maybe not to get a third or fourth. But really, like, you should feel comfortable when you're meeting with a doctor, and like it's a collaborative effort and they're listening to you and hearing what you have to say. And if you're bringing any ideas to them, and if they don't know something, they should, if like, you should feel like they're able to go and research things, and not that they're dismissing you and ignoring you and telling you that things are normal. But just like really trusting yourself is the biggest advice to advocate for yourself. And I think for myself, especially, I'm sure others feel this way too, but like connecting with other people online has been like a great way to improve like how I advocate for myself and trust myself. Just seeing like other people are going through similar things. It's not just me, especially when my symptoms were first beginning. I was really young as a teenager and didn't know any, like, none of my friends or family had gone through this. So I really felt isolated and like, am I really being dramatic? Is it just me? But connecting to people online showed me that it wasn't, and then helped me learn about other things that might be helpful to try, or like doctors or different providers that could be helpful. And also, like in relation to doctors, if you're able to, there are some doctors who are more like endometriosis excision specialists, but do have some experience or not a lot of knowledge with adeno, and they might provide free consults through telehealth, like through Zoom or through the phone. That's something I did years ago by phone for free, and I found that was helpful as well, to hear from someone who's seeing like adenomyosis every day and endometriosis, kind of what they thought could help, or what might not be going on, or what might be going on. So that can be a great tool as well, especially if you're not sure and having issues locally, to get that expert opinion, even though they might be across the country, and just kind of see what they think, because that doesn't mean you need to go to them for surgery. They're often just trying to help people, and open to just like doing a one-time consult.
So we have a question. I'm 20, have been dealing with adeno for 3+ years. My pain is on the severe side and have no quality of life. I've had 2 laps, 1 excision of endo without pain relief. The assumption is adeno is the major cause of my pain. So I have been wanting a hysterectomy for a little under a year now, but doctors don't want to because I'm young and don't have kids. Any tips on how to get around that?
Yeah, I'm that's tough. So first, I'm so sorry you're going through that. I can definitely relate. Like, I had surgeries before I learned of excision for endo, and then ended up finding and learning about excision, and then had excision, was really hopeful that would help me, but still was having severe pain and it was worsening, and then learned it was adeno. And I was very young too. I was 23 when I had excision, and then things worsened, and then 24 when I had my hysterectomy. So I did see a provider who's kind of like, he only sees endometriosis and adenomyosis patients for excision. So he's only a surgeon. And I did have to advocate a bit for myself because of my age, not having any prior pregnancies. I think for me, the biggest tools was like keeping track of my symptoms, and then all of the different things I've tried, like surgeries, medications, different consults I had done, because I had gone to so many different specialists, tried so many different things, like different imaging, medications, injections, so much to try to help my pain. And see, like writing down, I wrote kind of like an autobiography, like a couple pages in a way, about how this was impacting my life, because I was missing a lot of school and really struggling, couldn't wear pants, like I was just miserable. And I think those helped me, to kind of plead my case about, this, my quality of life is most important. And like at the time, I wasn't sure if I wanted to have biological children, but my quality of life was most important to me, and just sharing that with them. But I know even that for some doctors isn't enough, and there's a lot of stigma around age. But possibly for you, if you're able to maybe like do a consult with a doctor, they might be in a different state. That might be the next route to try, if you haven't seen and got like a second opinion with a surgeon locally to you, and see, because somebody who's seeing adeno every day may be more empathetic and understanding, knowing like age doesn't matter, this disease is really severe and can be progressive pretty quickly, and people's quality of life is most important. But if you want to message me on Instagram as well, like I'm happy to help you, connect you to resources that I can to support you as well, because I know it's really hard.
So much for that. That's I can only imagine. I was diagnosed with adenomyosis when I was 38. I'm getting very emotional for whatever reason, but I have a lot of compassion for young people who have to go through this. I certainly wouldn't have had the courage or even the tools or knowledge to advocate for myself. So I think what you're doing is really, really, really great. Because pain is hell.
Yeah, exactly. And like,
Yeah.
I know there's so much pressure put on us about like, what if you want to have children? And it's never like, well, right now, and for the past however many years, I can barely function and go to work, go to school, or be happy. And like, that's most important. But unfortunately, it's like there's so many different people in like the,
Yeah.
having a say in that decision, and just it makes it so complicated.
But there are doctors who are listening to their
Yeah,
patients and who will
there
help
are.
you,
Yeah.
yeah, resolve these issues. So we have another question. If the uterus and cervix are removed for adeno, what are the side effects of the hysterectomy? Example, will the ovaries lose their life earlier, weight gain, bladder bowel symptoms, pelvic floor muscles getting weak, anything else?
Yeah, so if just the uterus and cervix are removed, so the ovaries are left, I think that's a big misconception as well, that the ovaries will stop functioning. Like, I know that was one of my concerns before my hysterectomy, being young, like what will happen with my hormones? Will I need hormone replacement? But like I consulted with a few different doctors, and the consensus was you'll like the ovaries will be fine, and like right after surgery they might kind of like go to sleep, was what was said, because of the shock of getting the uterus out and in the surgery, but they should wake up and be functioning. There's a lot of information about that online. I'm happy to share with you if you would like, but yeah, generally speaking, they're okay. And like I myself, I only have one ovary because I lost my other one 4 years ago, and this one is very much awake and functioning, and my hormones are fine. But some people do, for a variety of reasons, may have hormone issues, even with two ovaries. So there are specialists like bioidentical hormone specialists that can be helpful to kind of talk with, even pre-surgery, to see about what to expect, what things to look out for. And I think related to the other concerns, those are, I think, are always kind of risks with surgery. So things to discuss with your doctor and see kind of what's the likelihood of those may be. I think pelvic floor physical therapy is something that should always be done after hysterectomy, because of, especially if you've been in a state of severe pain for so long, like your pelvic muscles are going to be so flared up, and then the surgery, and then kind of being stuck and laying down for a while after surgery. So that can be great to kind of help with those risk factors as well. And just like that's something the doctor should be kind of exploring pre-surgery and then during post-op as well, to make sure everything is okay. But definitely things to discuss with your doctor and see kind of what your risk factors are and what their outcomes have been from other patients as well.
I have a couple more questions. Can a run-of-the-mill OB-GYN do a hysterectomy for adeno, or should we be seeing a specialist? Does it make a difference?
That's a great question. I'm not sure how. Yeah, that is a great question. I'm not really sure. I think that's debated, especially I think it does matter if you have suspicion that you also have endometriosis, or maybe another condition like pelvic congestion syndrome or something, that might also need some surgical procedures done during the hysterectomy. But I think if you don't have those conditions, or aren't concerned about that, I think maybe it could be okay to have a gynecologist who's not an endo specialist do that. But that would depend on kind of how many surgeries are they performing, like again, asking their outcomes, their knowledge with that, and like performing hysterectomies, because it is a very common procedure, like a hysterectomy in general. But if there's other potential complications like endometriosis going on, I think definitely important to see someone who performs excision, because having multiple surgeries, just can result in more pain, or like if you have to have a hysterectomy and then later on have more surgeries, that's not always something, I don't think anyone would want that. So maybe trying to do like one surgery if possible.
Is it true that people with adenomyosis don't respond quote, normally, typically to hormone options. For example, for this individual, all hormones make me bleed and end up making my pain worse. I bled for 13 months every day, heavily while on Depo-Vera. 3 times the injections.
Oh, I'm sorry, that's horrible. I think so. I would say like hormones are definitely the most common treatment for adenomyosis presently and historically. So a lot of people have tried hormones, including myself, and hormones can be a great option for people, but like yourself, and it's not always a great option. And it's like it could be that specific hormone. Like sometimes you have to try multiple different ones, including like injection, NuvaRing, IUD, just a variety of ways. So it's so individualized, which is hard to answer, but I will say like a lot of people are on hormone therapy long term, like continuously not having a period. And that is a way that they manage their adenomyosis and are doing really well with that. And then on the other hand, people don't respond to hormones, or maybe they did previously and then it stopped working. But if you haven't explored other hormones, that might be something to bring up to your doctor, or it just might not be working well with you. And I wonder maybe like if like bioidentical hormone specialist could be someone that maybe could help you as well.
What are, how can a group like ours be a partner to the Adeno Project and other advocates, to raising awareness about adenomyosis?
Yeah, that's a great question. That's something I've definitely been thinking about. And like COVID has made things complicated, of course. Like especially from like last year to now, I'd hoped things would be better, but they're kind of, status quo, which is just the way it is for now. So there are things I had hoped that I would do by now from last year. But I think for the future, like I really want to work with other groups, all around the US and then the world as well, and see what we can do. I think the biggest thing we could all work on together is raising awareness, trying to make more noise for adenomyosis, and talking to our elected officials, like health departments, to really recognize this disease. And then hopefully that will create noise, so then we can advocate for more research funding. And then in turn, that will result in better treatment options, diagnostic options, and more. Something I really want to work on is like working with local legislation and federally to kind of advocate for that and lobby for more options. That's something like I really hope for. I'm not exactly sure how to get started with that. It's something I'm like currently researching and trying to figure out. So if people want to work with me on that, that would be great, because like regardless of where we live, I think we could do that everywhere. Of course, like how I raised awareness this year and last year, like with proclamation and bridge lighting, those are local, and processes may differ based on country and state, but like we all have legislation and elected officials we could talk to and reach out to raise awareness. So I think like maybe forming some kind of like work group where we're meeting monthly or like quarterly to think of ideas and what to say and do, and then like collectively doing that within our communities is probably the best approach to combating a lot of the stigma, and actually like showing them that we're here and we need help.
Yeah, I agree. Definitely, it's a lot of work, and especially when you're dealing with legislations and legislatives, and
Yeah.
you need a lot of energy for it, and not a lot of resources, and
Mhm.
certainly a lot of support. But
Yeah, exactly. Like if we could find, maybe fundraising to hire like a consultant, like it's like a really, right. I've had this idea for a while, and it's been an idea because it's just so complicated. And
yeah,
I'm like, I don't even
they
know
don't
where
make
to
it
start.
easy. They certainly don't make
Yeah,
it easy. So,
I know.
um, got another question. Do hormones stop progression of adeno, or would the disease continue to grow even if the bleeding and pain is gone?
That's a great question. I'll be honest, I'm not exactly sure. I haven't seen that come across too much, like that specific topic addressed. So I'm not sure, but that is a great question that I'll have to investigate more. My assumption would be yes, just hearing from like stories and kind of what the research has showed that I've read about so far, but I'm not sure.
Another question, and I know you briefly talked about this, and maybe it would serve to reiterate what you said earlier, but if you suspect that you have adeno, how would you approach your doctor without making it seem like you're self-diagnosing?
Yeah. So I think I know like for myself, I went into doctor appointments. So like first I'll start like when I was a teenager and endometriosis, it was brought up to me. So like doctor was prepared based on what the referring doctor had talked about. But then like future doctor appointments, I created the appointment and kind of went in with what my concerns were. So I think it can be helpful to frame it as like showing what your symptoms are. And if you can, bringing with you like a journal or diary of all the information you've tracked to really show how serious you are about this, and showing like how this is impacting your life. And then I think that can show like, yes, you've done research because this is so impacting your functioning so much. I think anyone would do research on that if they're able to, and then say like, this is something that's come up for me in my research. And then I think that's fine. I think like it's powerful to bring that up to a doctor, like that you've done research and this is what's come up, because it's really intimidating to talk to them because they're seen as the expert, but you're also the expert too because you know so much about your body. And I think it's important to be educated on it so you can really understand and be a part of that conversation. And any doctor, I would hope, would be really interested in like the patient who wants to be a collaborator on that and really involved to figure out what's going on. But I think with adenomyosis too, you may experience some pushback because even within gynecology and within doctors who say that they are pelvic pain specialists, that doesn't mean that they're educated on adenomyosis. They receive such a small amount of training, like kind of generally speaking, within medical school on endometriosis, and then on adenomyosis, that's even smaller. So it's like kind of figuring out what their experience is with adenomyosis will be tough. It's even if it's on like if they're part of an institution, even if it's on their website, that doesn't mean they themselves are too experienced with it. So even if they're like, oh, I don't know, like I think seeking another opinion can be helpful too if you're getting a lot of pushback with that, or if they're kind of dismissing you, saying like, oh, you don't have that, there's no way. Yeah. So really, again, like trusting yourself, if you're concerned that this is something that you have.
A really, really great tip. So for me personally, like, are there any other organizations or resources we should be following on social media or websites we should check out um, uh, for the latest or for anything that has to do with adenomyosis? And of course, the quality of the information is also very important because we do not need to spread misinformation about adenomyosis.
Yes,
so
exactly. Yeah. Yeah, definitely. So I would say like for doctor affiliated like practices that have a large presence on social media and their websites, like Center for Endometriosis Care is great. Like that, I think that's probably one of the first places I ever learned about adenomyosis. Like they have different sections on their website and post content on social media and are very responsive. Like they're one of the practices that provide free telehealth consults if you send them your records and are interested in seeing kind of what they have to offer in terms of surgical procedures. And then like Dr. Vidali, he is on Instagram and has a website as well. He is an endometriosis surgeon and then also reproductive endocrinologist, I believe. I know he also provides infertility and like IVF support. And he's really interested in adenomyosis, and miscarriages is another area he's interested in. So his social media is great for that. And then like the Endo Girls blog is really great. Like they're very into making sure that the research, like they're reviewing the research and putting out accurate information on adenomyosis, endometriosis. and related issues. There are so many other accounts too, like different ones that are in like different languages. Like there's some in Latin America, in Iceland, that I usually will post on my Instagram. And that made me think I should probably have maybe like a post or section about helpful accounts as well,
That'd be
especially so
great.
people could connect if they live in those areas. But yeah, definitely, like you said, like making sure the information that someone is putting out is accurate. So I think like having citations is helpful to know, like this post is based off this research. That's something I've been trying to do like for this month when I'm sharing kind of educational information, so that people can go to those sources and then really read about it themselves as well.
We've got one more question here. In what ways can adenomyosis cause poor pregnancy outcomes? Also, how long does it take for the adeno to get severe enough to cause problems with pregnancy? Asking because my pregnancy in 2014 ended in premature C-section and extended NICU stay for my baby, and I'm not sure if I had adeno back when I was pregnant. Adeno was confirmed last year after my hysterectomy.
Okay. Yeah, so that's a great question. I think that's like one of the highly debated areas within, the limited research that does exist on adenomyosis. It's not fully known what the association is between adeno and infertility or poor pregnancy outcomes. I know there's like some of the surgical procedures do have some potential risks related to pregnancy. Mainly like presacral neurectomy, the risk is related to contractions, like feeling contractions. And then if you have like an adenomyectomy of the focal adenomyosis, that could be connected to a possible pregnancy related risk. But largely speaking, I'm not sure because there's such like debated information, but I would probably tell you to go to like Dr. Vidali. He's in New York. So if you want to Google that name in New York, you'll find his social media because he posts a lot about fertility and endo and adeno. And I would say he's probably one of the best people to talk that talks about that topic. And he also works with the Endometriosis Summit. So I know they've done posts about pregnancy risk and miscarriage and that topic in general. So definitely look at his content and reach out to him too. Maybe he can put you in the direction of some research on that topic if it does exist.
Points. So we've got 5 more minutes. I want to thank you for joining us. I know it's very, very, it's never enough time to go through everything. Actually, I've got one more question if you don't mind. If you have time for one more. Okay, great. Thank you. All right. So endo excision specialists differ so much in their opinions on uterus and cervix removal for diffuse adeno. It's so confusing whom to believe and which surgeon to choose. 3 have said your ovaries will lose their life early and you will go into early menopause. 2 have said your ovaries will continue to function well and you will have natural menopause. How does one deal with the confusion and which endo specialist do we choose? Please help.
Yeah, I'm sorry. That's such a tough question. I think that's definitely one of the struggles with these diseases is like there's such differing opinions even with the surgeons who are seeing patients with these conditions. I would say for all of them, like asking them if they can direct you maybe toward research about those outcomes related to menopause and on your ovaries. I think that could be helpful in figuring out who you feel most comfortable with and like what information you feel like is most accurate. And maybe seeking another opinion too to see, but like someone who has, I don't know if these providers already have experience with like adenomyosis and these complicated pelvic pain conditions, but seeing someone who's performing hysterectomies regularly and other kind of procedures, maybe they might be better suited for this and be able to give their advice and insight. But really, yeah, I'd say like figuring out where is this information coming from and maybe bringing it up to all of them, or if you narrowed it down to 2, kind of like, well, I'm hearing this from another provider. Can you help me figure out where this information is coming from so I can make the best decision for myself? I think that's the best way maybe to handle that, because that is really tough, and right, that doesn't help you, and it makes it even more complicated and confusing for you.
Yeah. Caitlin, we've got a couple more minutes. Can you drop us your social media handles? And also, I'm not sure, I can't remember if you have a website ready or not, but please feel free to share it really quickly before, we end the call,
Yeah.
the
Yeah.
talk.
So yeah, social media on so like on TikTok, on Instagram, Facebook, and Twitter is the Adeno Project. So THE Adeno Project. And then website will be the adenoproject.com. It's under construction. That's something I'm working on actively. So hopefully we'll be up very shortly, because my hope with that is to have like reputable resources and links on there, so then people can connect to that and connect to like other organizations and people that can be helpful through all the different stages of this disease and related diseases and things like pelvic floor physical therapists and such.
Just to be clear, everybody, this lady is doing it by herself. My goodness. Thank you so much for joining us, and I hope we can do this again, especially as hopefully we'll get more funding, in the future for both adenomyosis and endometriosis. We really appreciate it. If there's any last few things you'd like to tell the community.
Yeah, I would just say, like, if you want to get involved in advocating for adenomyosis, I'd love the help and support. And I love connecting to people regardless of where you are. So you can just DM me on Instagram. That's the best place to reach me. So we can really like do this together. And even if you just are able to like share things, that is super helpful too. It doesn't always have to be, like writing or like speaking at an event or something, because I know there's so much going on and time is limited. So thank you.
Thank you so much. Thank you, everybody. We will have this recording up next week, so be sure to check out our social media. And again, thank you, Caitlin from the Adeno Project. It is Adenomyosis Awareness Month, so please check out her Instagram. And I can't recall if you have any t-shirts, if your t-shirts are still on Etsy.
Yeah, so with the Fierce and Fear, it's my friend Shannon, Fierce and Fearless, I believe is the name. But I have it linked on my Instagram.
Awesome. I'll be getting one. So if you have any questions for Caitlin, please feel free to either message us or, or message her on the Adeno Project. Again, thank you so much for this for really great information about adenomyosis. And everyone, I hope you have a great day. Thank you.
Thank you.
Thank you.